With all this wind, San Diego's emergency homeless shelters are open tonight to protect people against the elements. That includes this brand new shelter that just opened in the old Central Library building in the East Village. It's just one of the city's efforts to tackle San Diego's homeless crisis. And it's opening just as the annual count of the homeless population across San Diego gets underway. ABC 10 News anchor Kimberly Hunt joins us live from the San Diego Rescue Mission. Kimberly, that count is showing just how pressing this issue is getting.
Absolutely. The homeless situation in San Diego is undisputably a crisis. On any given day, we know there are over 8,000 homeless people on the streets of San Diego. And I'm here at the Rescue Mission in Bankers Hill, where they serve about 300 people every night and provide services both short-term and long-term for men, women, and children. The dinner started behind me about 4 o'clock. And early this morning, volunteer teams began spreading out across the county to begin the annual point-in-time count. Our ABC 10 News crew was there as San Diego Mayor Todd Gloria spoke to those crews. And each year, the federal government requires communities to do a count of the homeless population. That's how they decide to divvy up the federal funding. The volunteers walk the streets to count, but also get critical information that helps local officials understand the causes of the crisis.
I think it's about recognizing people and how do we make sure that they are seen, that they have a chance to sort of speak on their own history, their own work, what brought them to that situation.
Unfortunately, we have seen a spike in homelessness across San Diego in the last few years. And that's no surprise for most of us. We can see the problem growing on the streets across our county. And it's being driven by the rise in home prices, then the pandemic, then inflation. We caught up on Zoom with Deacon Jim Vargas from Father Joe's Villages, and he says there are concrete things that can be done, not just to get the unhoused into shelters, but also keep those hanging on in their own homes stable rather than slipping into the streets.
Right? Far too long. There are people suffering on the streets. So with the city council here, it warmed my heart, more than warmed my heart, actually, in the fourth quarter of last year. They declared housing as a human right. Wonderful. I applaud them for that. What are we going to do if that is the case? If housing is a human right, and there's so many people who are falling into homelessness, what are we going to do to achieve that?
He suggests streamlining the process to make it much faster to get housing built and shelters open, as well as more services to help people who do find homes be able to stay in those homes. And I am joined here in the dining room of the Bankers Hill Rescue Mission by Paul Armstrong, the VP of Programs. And Paul, I know that you were out at 4 a.m. this morning in that point count. Tell us what the difference is this year from the past.
Yes, well, unfortunately, we did see an increase. So when the official numbers come out, I'm expecting it to be higher, sadly, than the 8,000 this last time. And so it's showing that there's a lot more work to do, and we got to roll up our sleeves and get to work.
And what services do you provide here at the Rescue Mission?
Well, we focus on trying to get people off the street immediately and permanently. So we offer short-term shelter for women and women with children, and then long-term shelter for men, women, and single parents.
We know one of the difficulties is the mental health issue. What are some ways you think that we could handle that and would help the entire problem?
Yeah, so it's recognizing this is a complex problem that requires a complex response. And it really is about our systems integrating and talking to each other. The by name list is an important thing that's coming out. All of those are pieces where the more we coordinate our efforts, the more complex our response can be to those who need us the most.
Explain that, what it is for people that don't know.
Well, so what I mean is for someone who has a mental health issue, first it's even getting them to recognize the need that they have, building trust with them, and then having the right proper care that we can get them connected to. So not all mental health is the same, and so making sure that we get them to the level of care that they need so that they can get the right services to address that mental health issue.
And you've been here at the Rescue Mission for several years. You've seen the problem grow. People are seeing it on the streets all over our county. Is there reason to be optimistic about it?
Absolutely. Like, we can't give up hope. And one of the things I am confident in is our community truly does care. Always grateful for the number of donors and volunteers and people who just get involved and want to be involved and want to get this stronger. We have a lot of smart people in this community, and I really do believe as we continue to work together and as we continue to focus on the solutions of how do we get people off the street immediately and permanently, I think we can turn this around.
That's a great way to end it. There is hope.
Yes, absolutely. Always hope.
Love that. Always hope. And Wale, we're going to take you inside the kitchen here at the rescue mission where they pump out almost 1,000 meals a day for the guests of the mission and the staffs. We'll show you that coming up in 30 minutes. Back to you.
Thanks, Kimberly. There is always hope. Thank you so much.